Hey everyone! Today we're jumping into a real workhorse of therapeutic endoscopy, Argon Plasma Coagulation, or APC. It's an absolutely essential tool for controlling GI bleeding, and by the end of this quick guide, you'll have a really solid handle on how to use it safely and effectively. So to really get what APC is all about, you've got to see how it's different from your standard contact cautery, right? A contact probe has to actually touch the tissue, which gives you a really focused, deep burn. APC, it's the total opposite. It works from a distance, kind of like spraying energy over a wide area. And here's the most important part. It creates a very superficial injury, only about 2 to 3 millimeters deep. This is absolutely the key to its safety. So here's our game plan. We're going to start with why APC is such a fantastic non-contact tool, then we'll dig into the physics of how it actually works. After that, we'll get practical and cover the technique, its most common uses, and finally, we'll talk about the potential complications you have to know about. All right, first up, what makes this spray-on tool so valuable in your toolkit? Let's break down its key advantages. The advantages are pretty compelling. It's relatively easy to learn, and it's incredibly fast for treating diffuse lesions like angiodysplasias. You can pretty much paint a whole area in no time. But the biggest advantage for sure is safety. That limited depth of penetration really lowers the risk of perforation. Plus, because the plasma can kind of flow around corners, you can even treat lesions that are just around a fold. Pretty cool. Okay, so now let's get into the science of it, because really, understanding how this thing works is the key to using it safely. The whole process is this fascinating 4-step sequence. First, a jet of inert argon gas shoots out from the probe. At the exact same time, a high voltage spark, and we're talking a whopping 6,000 volts, ionizes that gas, creating a state of matter called plasma. Now, this plasma is electrically conductive, so it naturally jumps to the nearest path to ground, which of course is your patient's tissue, and that's how it delivers the thermal energy to cause coagulation. And this is a really key point. It's a super common misconception. APC is not a laser. A laser is a focused beam of light. This is totally different. APC uses a conductive stream of ionized gas. It's a completely different physical principle at play. So that plasma is the magic ingredient delivering the energy. Its physical properties are what guarantee it only coagulates the tissue superficially. And that, again, is the cornerstone of its safety, especially when you're working in the thin-walled right colon. All right, let's get to it. This is probably the most important section for you as a trainee, how to actually use APC safely and effectively. This is where the rubber meets the road. Okay, before you even start, there's a critical setup checklist. That grounding pad, totally non-negotiable. The plasma has to have that path to ground. Then you'll turn on the gas, set your flow rate, pick your power setting, and finally, don't forget this, you prime the probe with argon by hitting the purge button before you put it in the scope. Choosing your power setting is a huge decision. Here's a simple rule of thumb. For any thin-walled areas, like the right colon or the small bowel, you want to stay low, somewhere in the 20 to 30 watt range. For thicker areas like the stomach, or if you need to debulk a tumor, you can crank it up a bit, maybe 30 to 40 watts. Always start low and go up if you need to. This is a fantastic pro tip for avoiding mistakes. For your very first pulse, do it on purpose from too far away where nothing happens. Then, just slowly move closer with each pulse until you see that perfect white coagulation. What you're doing is calibrating your own eye and hand to the exact distance you need, which helps you from getting too close and causing a contact burn. Okay, during the procedure, these 4 safety checks are your new religion. They're non-negotiable. First, make sure you can see that little black stripe on the probe so you know it's safely out of the scope. Second, fire when you're close, less than a centimeter away. But third, and this is a big one, never make direct contact. And fourth, remember you're pumping gas in there, so you've got a suction from time to time to avoid over-distension. So now that we know how to use it safely, where does it really shine? Let's look at the main clinical situations where APC is going to be your go-to tool. This is a great summary of APC's greatest hits. It's absolutely fantastic for angiodysplasias with immediate success rates, often close to 100%. For more diffuse conditions like JV, watermelon stomach, or radiation proctopathy, you can just methodically paint the affected areas over a few sessions to control bleeding. It's also a really powerful tool for debulking tumors to either relieve an obstruction or control that oozing surface bleeding. All right, let's wrap this up. We're going to cover potential complications because, let's be real, no procedure is risk-free,
and then we'll summarize the most important points for you to take with you. So, APC is very, very safe, but the complication everyone worries about is perforation. The good news? It's really rare. Large studies show a rate of about 0.2%. But the risk is real, especially in the thin-walled right colon, which just hammers home how important it is to use low power and stick to that non-contact technique we talked about.
And there are other issues that can pop up. Too much gas can cause things like subcutaneous emphysema. If you accidentally touch the probe to the tissue, well, you've just caused a deep burn and defeated the whole purpose of using APC. And in an unprepped colon, there's a very rare but catastrophic risk of bowel explosion. That's why a full lavage is absolutely essential.
So, what's the bottom line? Here it is. Remember, APC's niche, it's a non-contact tool for diffuse superficial bleeding. Its safety and its effectiveness are completely tied to your technique, which means mastering those safety checks is everything.
And this is the question I really want you to carry with you. As you move forward in your training and see all these different clinical scenarios, think critically about it. Weigh the benefits of its broad, superficial treatment against the risks. Because knowing not just how to use a tool, but when to use it, that's what makes a great endoscopist.